Welcome to Med About You, your health solution. What is erectile dysfunction, AD? Erectile dysfunction, also known as impotence, is a condition characterized by the inability to achieve or maintain an erection sufficient for satisfactory sexual performance. It is a common sexual health problem that can affect men of all ages, although it becomes more prevalent with age. How erection works and what happens in AD. During sexual arousal, the process of achieving an erection involves a series of physiological events. Here's a simplified explanation of how it works. 1. Sexual stimulation, sexual thoughts or sensory stimulation, touch, sight, etc. Trigger signals in the brain. 2. Nerve signals. The brain sends signals through the nerves in the spinal cord to the penis. 3. Relaxation of blood vessels. The nerves release chemicals that cause the blood vessels in the penis to relax and widen. 4. Increased blood flow. The relaxed blood vessels allow increased blood flow into the erectile tissues of the penis, causing it to expand and become erect. 5. Trapped blood. The expanded erectile tissues compress the veins, preventing blood from leaving the penis and maintaining the erection. Causes. Erectile dysfunction can be caused by various physical, psychological, and lifestyle factors. Common causes include physical causes. 1. Cardiovascular disease, poor blood flow to the penis due to blocked or narrowed arteries. 2. Diabetes, nerve damage, and impaired blood flow. 3. Obesity, linked to decreased testosterone and poor circulation. 4. High blood pressure and cholesterol affect blood vessel health. 5. Hormonal imbalances, low testosterone or thyroid issues. 6. Medications, antidepressants, blood pressure drugs. 7. Nerve damage from spinal cord injuries or surgeries. Psychological causes. 1. Stress and anxiety can interfere with sexual arousal. 2. Depression affects both desire and performance. 3. Relationship problems, emotional or communication issues can contribute. Lifestyle factors. 1. Smoking, excessive alcohol, and drug use impair blood flow and nerve function. 2. Lack of exercise and poor diet lead to conditions that affect circulation, like heart disease. ED is often a combination of physical and psychological factors, and treatment depends on the underlying cause. Symptoms. The primary symptom of erectile dysfunction, ED, is difficulty achieving or maintaining an erection firm enough for sexual intercourse. Other associated symptoms may include 1. Trouble getting an erection, difficulty becoming erect, even with sexual stimulation. 2. Difficulty maintaining an erection, being unable to keep an erection long enough for sexual activity. 3. Reduced sexual desire, a noticeable decrease in interest in sexual activity or libido. Occasional difficulty with erections is normal, but if these symptoms persist and interfere with sexual satisfaction, it could indicate AD and medical consultation is recommended. Treatment. Lifestyle changes. 1. Exercise, regular physical activity, especially aerobic exercises, improves blood flow and cardiovascular health. 2. Diet, a healthy diet rich in fruits, vegetables, whole grains, and lean proteins supports heart health and circulation. 3. Quit smoking. Smoking affects blood flow, and quitting can improve erectile function. 4. Limit alcohol. Reducing alcohol intake can help restore erectile function. 5. Stress management. Reducing stress through relaxation techniques or therapy. Medications. Sildenafil, Viagra, Tadalafil, Cialis, Vardenafil, Levitra, and Avanafil. Stendra. These drugs enhance the effects of nitric oxide, a chemical that relaxes muscles in the penis, increasing blood flow.
Foods that are beneficial for erectile dysfunction, ED. Erectile dysfunction is often linked to poor blood circulation, low testosterone, nerve damage, stress, or underlying health issues like diabetes and high blood pressure. Certain foods can improve circulation, boost nitric oxide, balance hormones, and support vascular health, all vital for strong erections. 1. Leafy green vegetables, spinach, kale, beet greens. Why beneficial? High in nitrates, which convert into nitric oxide, a compound that relaxes blood vessels and improves blood flow to the penis. Extra benefit, rich in folate, vitamin 9, which reduces homocysteine levels, linked with ED. Best way to eat, add spinach to smoothies or enjoy beetroot juice before intimacy for a circulation boost. 2. Beetroot. Why beneficial? Packed with nitrates, beetroot juice is often called nature's Viagra. Effect, increases blood vessel dilation, leading to stronger and longer erections. Extra benefit, improves stamina and exercise performance, helping with overall sexual energy. 3. Oily fish, salmon, mackerel, sardines. Why beneficial? Rich in omega-3 fatty acids, which improve blood vessel flexibility and circulation. Extra benefit, boosts dopamine levels, a pleasure hormone that enhances arousal. Best way to eat, 2 to 3 servings per week, grilled or baked instead of fried. 4. Nuts and seeds, almonds, walnuts, pumpkin seeds, flax seeds. Why beneficial? High in L-arginine, an amino acid that the body converts into nitric oxide. Extra benefit, contains zinc and magnesium, essential for healthy testosterone levels. Tip, a handful of nuts daily supports both heart and sexual health. 5. Dark chocolate, 70% or higher cocoa. Why beneficial? Contains flavonoids that improve circulation and reduce blood pressure. Extra benefit, enhances serotonin levels, boosting mood and desire. Note, keep portions small, 1 or 2 squares, to avoid excess sugar. 6. Watermelon. Why beneficial? Contains citrulline, which is converted into arginine, then nitric oxide, improving penile blood flow. Nickname, sometimes called natural Viagra. Best way to eat, fresh slices or blended into juice, without added sugar. 7. Pomegranate. Why beneficial? Rich in antioxidants, pomegranate juice improves blood vessel health and reduces oxidative stress, a major factor in ED. Research, some studies suggest pomegranate juice may improve erection quality over time. 8. Garlic and onions. Why beneficial? Improve blood circulation by lowering cholesterol and blood pressure. Extra benefit, garlic contains allicin, which enhances nitric oxide production. Tip, eat raw or lightly cooked for maximum benefits. 9. Berries, blueberries, strawberries, blackberries. Why beneficial? High in flavonoids, which lower ED risk by improving vascular health. Study, men who ate berries 3 times per week had a significantly lower risk of ED. 10. Oysters and shellfish. Why beneficial? Packed with zinc, which is essential for testosterone production and sperm health. Extra benefit, known as a natural aphrodisiac. Note, eat in moderation, especially if you have cholesterol concerns. Lifestyle pairings with food for maximum benefit. 1. Exercise regularly, boosts nitric oxide and testosterone naturally. 2. Limit alcohol and quit smoking, both damage blood vessels. 3. Maintain healthy weight, obesity is a major ED risk factor. 4. Manage stress, chronic stress and anxiety interfere with erections. Bottom line. The best foods for ED are those that improve blood flow, nitrates, flavonoids, omega-3s, boost nitric oxide, arginine, citrulline, and support testosterone, zinc, vitamin D, healthy fats. Consistency matters. Eating these foods daily helps not just sexual health but also heart, energy, and overall vitality.
Thanks for watching. Please like, share, and subscribe. For more informative video, please visit our channel Med About You.